This content is for informational purposes only and is not intended as legal, medical, financial, or insurance advice. Always consult a qualified professional, such as your healthcare provider, insurance representative, or licensed specialist, before making any decisions about diagnosis, treatment, or coverage for your dyslexic child. That being said, you know the moment when you realize your child needs more help than the school can give. That was me. I remember sitting at my kitchen table, surrounded by paperwork, trying to figure out how to pay for therapy and interventions for my dyslexic child and wondering if anything our insurance would cover. The short answer is almost nothing, at least not at first. In Kansas, our insurance wouldn't touch anything until we had an official diagnosis. Once we did, we could use FSA and our health insurance to get some reimbursement, but only after pre-authorization, and even then, every claim was reviewed case by case. Sometimes we get it approved, other times it denied, and it depends on the right documentation, the right codes, and let's be honest, sometimes the right person reviewing it. That's when I learned the secret. The system isn't set up to make this easy, but there is a way through it. You just have to know what to ask. So here's what I wish someone would have told me. When you call the insurance company or your FSA or HSA provider, don't say, "Does my plan cover dyslexia therapy?" That is way too broad. You will probably get a fast no. Instead, ask specific and concrete questions. Ask, does my plan cover evaluations for learning disabilities or reading disorders? What diagnosis codes are recognized, like for a specific reading disorder or dyslexia? Are intervention sessions covered? And if so, under what category? Maybe mental health, maybe speech language therapy, maybe educational therapy, maybe therapy other. Does the provider have to be a medical professional like a speech language pathologist or a psychologist? Do I need a doctor's referral to meet a medical necessity for that requirement? If services aren't covered, can I pay out of pocket and submit an itemized or superbill for reimbursement? Are there any limits, like how many visits per year or age cutoff? I know all of this information can sound tedious, but these questions can make or break a claim in the future. Once you get your answers, write them down. Ask your provider for a summary of benefits that include those specific codes that you asked for. Download a copy of your benefits guide. Make sure you know where dyslexia or reading-based issues are. Keep copies of invoices, progress notes, and letters from your child's therapist. You also might need to ask for an itemized invoice or superbill for services. Here's what is usually included in your superbill: the provider's name, address, credentials, the date and type of service provided for everything, an explanation of what was covered in the lessons, and the amount you paid. The paper trail can mean the difference between an approved claim and a rejection. In my specific instance, we needed to have our provider do an annual physical for our learners and submit reauthorization paperwork every year. With every claim, we also needed to include a copy of that paperwork. Sometimes we have an extra step, like having the provider resubmit the paperwork from their office just to verify everything. But our providers are great, and we know that this is a part of the process. And don't forget about assistive technology. Tools like text-to-speech software and reading apps can sometimes be reimbursed for a prescribed diagnosed learning disability. Home versions of applications like Bookshare can be authorized with that same paperwork, and we've also had annual fees covered by your insurance for other applications. Here's the emotional truth. Every no feels really, really personal, especially when you're just trying to help your child. But sometimes it's not a hard no, it's a not yet, or it's a not yet without the right paperwork. Coverage changes and plans evolved. What wasn't covered this year might be covered next year. And as open enrollment season is upon us, these can be specific questions that you want answered before you make those decisions. So don't give up after one call. Keep asking, keep pushing, because when your child starts to make progress, you'll know every call, every form, every follow-up, every piece of paperwork was worth it.